You know what's absolutely shocking? Most women over 70 are being pushed into medical tests and procedures that can actually do more harm than good at their age. I'm talking about routine screenings that doctors automatically recommend, but here's the truth nobody's talking about. After 70, your body has different priorities, and some of these tests can lead to unnecessary anxiety, overtreatment, and procedures that rob you of precious quality time instead of adding healthy years to your life. If you're approaching 70 or you're already there, what I'm about to share could literally save you from medical interventions that might hurt more than they help. Stay with me because by the end of this conversation, you'll know exactly which 5 health checkups you should think twice about, and more importantly, what you should focus on instead to truly thrive in your golden years. Before we dive deeper into this life-changing information, I want you to hit that subscribe button right now. Why? Because I'm here to give you the honest, science-based guidance about aging gracefully and naturally that most healthcare systems won't share with you. Every week, I bring you practical, real-world strategies to help you make informed decisions about your health, prevent unnecessary medical interventions, and focus on what really matters for longevity and vitality. Your future self will thank you for staying informed with content that puts your well-being first. Now, let me ask you something. Have you ever left a doctor's appointment feeling overwhelmed by the number of tests they want to run? Maybe you've wondered if all these screenings are really necessary, especially as you get older. Well, your instincts might be right on target. The medical community is finally starting to acknowledge what natural health advocates have been saying for years: more isn't always better, especially when it comes to testing women over 70. Here's what's happening in healthcare right now. We have this one-size-fits-all approach to preventive care that doesn't take into account your individual life expectancy, your overall health status, or the potential risks of the tests themselves. The result? Women in their 70s and beyond are often subjected to screenings that were designed for younger populations, leading to false positives, unnecessary biopsies, and treatments that can significantly impact quality of life without adding meaningful years. Let me share something that will probably surprise you. The first health checkup you should seriously reconsider after 70 is routine mammography screening for breast cancer. Now, before you think I'm being reckless, hear me out. The major medical organizations, including the American Geriatric Society, have been quietly updating their guidelines because the research shows something fascinating. For women over 75, especially those with limited life expectancy or significant health conditions, routine mammograms often detect slow-growing cancers that would never become life-threatening. The stress of false positives, the radiation exposure from frequent screening, and the potential for overtreatment of cancers that grow so slowly they wouldn't impact your lifespan can actually reduce your quality of life dramatically. Instead of automatic annual mammograms, the focus should shift to being aware of changes in your body, maintaining breast health through natural approaches like anti-inflammatory nutrition, regular gentle movement, and stress management. If you notice any changes, then by all means, get them checked. But the blanket approach of annual screening after 70, particularly if you have other health priorities, might not serve your best interests. And here's where it gets really interesting. The second screening to reconsider is routine cervical cancer screening, including Pap smears. Most women don't realize that if you've had regular normal Pap smears throughout your life, the risk of developing cervical cancer after 70 is incredibly low. The American College of Obstetricians and Gynecologists actually recommends stopping routine cervical cancer screening at age 65 for women who have had adequate prior screening with normal results. Yet many doctors continue ordering these tests out of habit or legal concerns, subjecting older women to uncomfortable procedures that are unlikely to provide meaningful benefit. The third screening that deserves serious consideration is routine colonoscopy. Now, this one might really surprise you because we've been told for decades that everyone needs regular colonoscopies. But here's what the latest research shows. For women over 75, especially those with other health conditions, the risks of colonoscopy complications can outweigh the benefits. The preparation alone can be dangerous for older adults, potentially causing dehydration, electrolyte imbalances, and falls. The procedure itself carries risks of bleeding and perforation that increase with age. What should you focus on instead? Maintaining excellent digestive health through fiber-rich foods, fermented foods for gut bacteria balance, staying hydrated, managing stress, and being alert to significant changes in bowel habits. If you've had normal colonoscopies in your 60s, the likelihood of developing life-threatening colorectal cancer that would significantly impact your life expectancy may not justify the risks of continued screening. But here's something that might shock you even more. The fourth screening to question is routine bone density testing or DEXA scans, especially if you're already taking steps to maintain bone health naturally. While osteoporosis is a real concern, the focus on bone density numbers alone can be misleading. Many women become anxious about their bone density scores and get pushed into medications with significant side effects, when they might be better served by focusing on preventing falls, maintaining muscle strength, getting adequate protein and vitamin D, and engaging in weight-bearing activities. The problem with routine bone density screening is that it often leads to a medical model approach that relies heavily on medications rather than addressing the root causes of bone loss through nutrition, movement, hormone balance, and lifestyle factors. Your bone health is much more complex than what a single test can reveal, and your fracture risk depends on many factors beyond just bone density. And here's the fifth screening that you should approach with caution: routine cardiac stress testing for women over 70 who don't have symptoms of heart disease. While heart health is absolutely crucial, routine stress tests in asymptomatic older women often produce false positives, leading to unnecessary cardiac procedures that carry significant risks. The radiation exposure from some cardiac tests, the potential for kidney damage from contrast dyes, and the cascade of interventions that can follow a positive test result may not improve outcomes for women over 70. Instead, the focus should be on maintaining heart health through proven natural approaches: anti-inflammatory nutrition rich in omega-3 fatty acids, regular gentle exercise appropriate for your fitness level, stress management techniques, adequate sleep, and maintaining healthy blood pressure and blood sugar levels through lifestyle measures. Now, you might be wondering, what should I focus on instead of all these tests? This is where the conversation gets really empowering. Your health strategy after 70 should shift from detecting disease to preventing falls, maintaining independence, optimizing nutrition, managing chronic conditions naturally, and focusing on quality of life. This means prioritizing vision and hearing health, because these directly impact your safety and social connections. It means focusing on balance and strength training to prevent the falls that are much more likely to impact your immediate well-being than the cancers these screenings are looking for. Let's talk about what really matters for thriving after 70. First, your nutritional status becomes absolutely critical. Many older adults develop deficiencies in B12, vitamin D, magnesium, and protein that can dramatically impact energy, cognitive function, and overall health. Rather than spending time and energy on questionable screenings, investing in proper nutrition assessment and optimization can provide immediate and lasting benefits. Sleep quality becomes another crucial factor that's often overlooked in favor of more dramatic medical interventions. Poor sleep accelerates aging, increases fall risk, impacts immune function, and affects every aspect of health. Addressing sleep naturally through proper sleep hygiene, managing evening light exposure, creating a calming bedtime routine, and addressing underlying issues like sleep apnea or restless legs can provide more immediate health benefits than many screening tests. Your social connections and mental health also deserve priority attention. Loneliness and depression in older adults have health impacts comparable to smoking, yet these factors are often ignored in favor of physical screenings. Maintaining social connections, engaging in meaningful activities, managing stress through meditation or gentle yoga, and addressing depression naturally can significantly impact both quality and quantity of life. Here's something else to consider: medication reviews become far more important than additional screening tests. Many women over 70 are taking multiple medications, and the interactions between these drugs can cause more immediate health problems than the conditions the screening tests are looking for. Regular medication reviews with a focus on eliminating unnecessary drugs and managing side effects naturally can provide immediate improvements in energy, cognition, and overall well-being. And here's a crucial point that many healthcare providers miss: your individual health goals and values should drive your medical decisions, not standardized guidelines designed for populations. If your priority is maintaining independence and quality of life, then interventions that support these goals like vision care, hearing aids, physical therapy for balance and strength, and pain management through natural approaches might serve you better than routine cancer screenings that may never impact your actual lifespan. This doesn't mean ignoring your health or avoiding all medical care. It means being strategic and focusing on interventions that are most likely to maintain your independence, energy, and quality of life. It means being an informed consumer of healthcare and asking the right questions. What is my individual risk? What are the potential harms of this test? How will the results change my treatment? What are my alternatives? The natural health approach to aging recognizes that your body after 70 has different needs and priorities than it did at 50. Your immune system, your healing capacity, your nutritional needs, and your risk-benefit calculations for medical interventions all change. A truly holistic approach honors these changes and focuses on supporting your body's natural wisdom rather than subjecting it to interventions designed for different populations. Remember, you have the right to informed consent for every medical test and procedure. You can ask about alternatives, you can request to wait and see, and you can choose to focus your energy and resources on interventions that align with your personal health goals. Many women find that once they stop the cycle of routine screenings that may not benefit them, they have more energy and resources to invest in the lifestyle factors that really do make a difference in how they feel day to day. If you found this information eye-opening, please subscribe to this channel because I'm committed to bringing you honest, science-based guidance about aging naturally and making informed healthcare decisions. Too many women are navigating these complex medical decisions without the full picture, and you deserve to have all the information you need to make choices that truly serve your well-being. But wait, there's something crucial we haven't talked about yet. What do you do when your doctor disagrees with these recommendations? How do you handle the pressure to continue routine screenings? And what are the specific questions you should ask to determine if a test is right for your individual situation? In my next video, I'm going to give you a complete script for these difficult conversations with healthcare providers, including the exact phrases that will help you advocate for yourself while maintaining a good relationship with your medical team. This information could save you from unnecessary procedures and help you focus your healthcare dollars and energy on what really matters for your long-term vitality and independence.